Narashino, Chiba Prefecture, July 30, 2025. In a sobering reminder of the growing dangers posed by Japan's intensifying summer heat, a woman in her 70s was found collapsed on the street in Narashino City, Chiba Prefecture, and later pronounced dead due to heat stroke. The distressing incident was reported by a passerby who noticed the woman lying motionless near a residential area and immediately contacted emergency services. The tragedy has sent shockwaves through the local community, drawing attention to the deadly impact of extreme heat, particularly on vulnerable populations such as the elderly. As Japan faces another relentless heatwave, the death has reignited public discourse about preventative measures, community support, and the urgency of climate resilience strategies. Scene of the incident, a shocking discovery in the morning heat. The incident occurred shortly after 10 a.m. in a quiet residential district near Junior Sudanuma Station. According to local police and fire department reports, a resident walking to a nearby convenience store spotted the woman lying face up on the pavement near the entrance of a narrow alleyway. The witness, a man in his 30s, immediately called 119 after confirming the woman was unresponsive. "I thought she might have tripped or fainted," he told reporters at the scene. "But when I approached, she wasn't moving at all. Her face was red, and she was breathing heavily. I panicked and called for help. Paramedics arrived within 10 minutes and attempted emergency treatment on site before rushing the woman to a nearby hospital. Despite the medical team's efforts, she was pronounced dead less than an hour later." Doctors confirmed the cause of death as heat stroke, a condition exacerbated by prolonged exposure to high temperatures and insufficient hydration. Victim's identity and circumstances. Authorities have identified the deceased as Mrs. Hiroko Tanaka Fan Ming, a 74-year-old resident of Narashino City who lived just 3 blocks from where she collapsed. She was reportedly on her way to a local supermarket on foot, a routine she maintained every few days. According to neighbors, she lived alone but was known to be active and independent. "She always greeted everyone with a smile," said a neighbor, Mrs. Agawa, who lives in the same apartment complex. "We used to see her every morning sweeping outside or walking to buy groceries. It's heartbreaking to think that this could happen so suddenly." Security footage from a nearby home showed Mrs. Tanaka walking unsteadily around 9:50 a.m., wiping sweat from her forehead and fanning herself with what appeared to be a flyer. Temperatures in Narashino at that time had already climbed to 33 degrees Celsius (91.4 degrees Fahrenheit), with a humidity level of 75%, a combination known to rapidly trigger heat-related illnesses. Medical experts. Heatstroke deaths on the rise. Medical professionals and public health officials have repeatedly warned about the risks of heatstroke, particularly for elderly individuals who may not sense dehydration or overheating as acutely as younger people. Older adults often have diminished thermoregulation and may not feel thirsty even when they are dehydrated, explained Drive. Kenji Watanabe, a Tokyo-based emergency medicine specialist. This makes them especially susceptible during heatwaves. A 30-minute walk in these conditions can be fatal if proper precautions aren't taken. According to Japan's Fire and Disaster Management Agency (FDMA), over 8,000 people were transported to hospitals for heatstroke-related symptoms nationwide last week alone, with 35 confirmed fatalities, the majority of whom were over 65 years old. This marks one of the highest weekly totals in the past 5 years. The growing threat of urban heat. Narashino, like many suburban areas around Tokyo, has seen rising average temperatures in recent years. The urban heat island effect, caused by concrete infrastructure absorbing and radiating heat, exacerbates temperature extremes in densely populated zones. Additionally, elderly residents living alone are especially at risk due to lack of family oversight and reduced mobility. "This is no longer just a summer inconvenience, it's a public health emergency," stated environmental policy analyst Ayaka Morimoto. "The death of this woman is tragic, but unfortunately not surprising. We need community-based strategies, such as daily welfare check-ins, accessible cooling stations, and public education campaigns targeting at-risk demographics." Local response and public reaction. Narashino City officials held a press conference in the afternoon expressing condolences to the family of the deceased and promising to intensify public outreach efforts. Mayor Naoya Kuroki said, "We are deeply saddened by this incident. The city will immediately review its emergency response and welfare monitoring systems, especially for elderly residents living alone. This is a preventable tragedy." Public reaction has been a mix of grief and anger, particularly on social media. Hashtags like hashtag Narashino heatstroke and hashtag protect our elderly began trending on X, formerly Twitter, with thousands calling for better infrastructure, such as more shaded walkways, misting systems, and city-funded cooling shelters. One post read, "It's 2025. No one should be dying on the street from heat in a developed country." This was someone's mother, someone's grandmother. Where is the support system? Family members speak out. Mrs. Tanaka's son, who lives in Saitama, spoke briefly to local reporters outside the hospital. "She was healthy and careful. We spoke on the phone just 2 days ago. I never imagined I'd lose her this way," he said, visibly shaken. "I wish I had convinced her to stay indoors during this heat." He added that his mother had been reluctant to use air conditioning during the day, citing concerns about electricity costs, a habit not uncommon among elderly citizens in Japan, particularly those on fixed incomes. Government and NGO calls to action. The Ministry of Health, Labor and Welfare issued a renewed advisory following the incident, urging citizens, especially senior citizens, to stay hydrated, avoid outdoor activities during peak heat hours, and use air conditioning even if only intermittently. The ministry is also exploring options for providing subsidies or discounts for electricity usage during summer months for low-income seniors. Nonprofit groups like Hot Weather Aid Japan have ramped up volunteer efforts, offering free bottled water, portable fans, and door-to-door welfare checks in areas with high populations of elderly residents. "We're mobilizing quickly, but this needs to be a national effort," said Director Satomi Ueda. "These deaths are not just statistics, they're a wake-up call." Looking ahead, what needs to change? As climate change continues to intensify weather patterns worldwide, Japan faces a future of increasingly hot summers. Experts agree that without structural adaptations, both physical and societal, the country may see more such tragedies. "We can no longer afford to treat heatstroke as an individual problem," said Dr. Watanabe. "It's a systemic issue requiring coordination across government, community, and healthcare sectors." Suggestions include installing more public cooling zones, deploying mobile hydration vans in urban neighborhoods, mandating welfare check-ins for elderly residents living alone, subsidizing air conditioner use for seniors, incorporating heatwave drills into community preparedness programs. Conclusion: a life lost, a warning given. The death of Mrs. Hiroko Tanaka is not just a personal loss to her family and neighbors, it is a painful symbol of a society struggling to keep pace with a changing climate. As Narashino mourns one of its own, the incident serves as a sobering reminder that Japan must act decisively to protect its most vulnerable citizens from the silent killer that is summer heat. How many more must suffer before real change begins?